So what are the signs and symptoms of PKD? The first sign of PKD is hypertension. As the kidney cysts grow in size, they compress the neighboring nephrons and the little blood vessels. Those blood vessels become starved of oxygen and they activate a system called the RAS system. This system is responsible for regulating blood pressure, and our body starts to reabsorb and retain salt and water. Eventually, we can get fluid in our lungs, fluid in our belly, and patients will get swollen ankles. Because the cysts grow, you can also have stasis of urine, which can lead to the formation of kidney stones. They can also develop pus inside, and one can get an infected cyst for which you need to be admitted to the hospital for IV antibiotics. Sometimes it also accumulates blood. The cyst can rupture and you can intermittently have blood in your urine. The most important thing is as they grow in size, they cause severe pain because they stretch the capsule of the kidney. Not only that, by compressing the neighboring nephrons, what happens? Well, you lose your kidney function. Your GFR begins to decline and eventually you end up on dialysis. As I mentioned earlier, the defect in polycystin doesn't only occur in the kidneys. It also occurs in the liver, pancreas, and spleen, so those organs can also develop cysts. Polycystin is also present in one of our heart valves, more specifically the mitral valve. So what happens is the heart valve gets loose and it gets floppy. It's called mitral regurgitation. So blood flows in a backward direction, eventually into your lungs, causing symptoms of CHF or congestive heart failure. Polycystin is also present in our tiny blood vessels in the brain, and those blood vessels eventually dilate and they form small aneurysms. Unfortunately, this can rupture, leading to a stroke.